The medical establishment has a reputation that has led the population into believing it is responsible for saving millions of lives and dramatically improving our quality of life. For example, in 2014, a CDC publication stated, modelling estimated that among children born during 1994 to 2013, vaccination will prevent an estimated 322 million illnesses, 21 million hospitalisations, and 732,000 deaths over the course of their lifetimes, at a net savings of $295 billion in direct costs and $1.38 trillion in total societal costs. We have shown previously that specific claims such as this are incorrect, as they are contrived models, disconnected from reality. However, what happens if we broaden the scope even further to the overall contribution of the medical system to reducing mortality? In this video, we'll examine research that attempted to find any evidence of net life saving that could be attributed to the most vaunted medical measures last century. This is of pivotal importance because the medico-pharmaceutical industry has become an insatiable beast that consumes an ever-increasing proportion of our resources. So the question needs to be asked, is there any evidence that this extravagant spend-up has led to an overall benefit for our communities? Despite its global dominance, this medical industrial complex has given us meagre, feeble comforts at vast expense. Its chief concern is its own survival and continued dominance, and its ethos is a betrayal of the scientific ideals of the Golden Age. Professor Seamus O'Mahony, 2019. Before I start the main part of this presentation, please take into account that we are not discounting anecdotal stories in which limbs or lives were saved. We are considering the total and net impact of the allopathic medical system, a system that is incredibly expensive, increasingly pervasive, and as we witnessed in the COVID era, one of the tools used to manipulate entire populations. It should also be noted that we are dealing with figures that assume the named diseases exist as discrete entities. You can watch some of our other presentations on these diseases which examine the case definition problems. In 2006, I was a newbie doctor working as a house surgeon in New Zealand public hospitals. It was at that time I first encountered my future husband, Dr. Mark Bailey. We were both on a 15-hour shift, and I sat down at the same doctor's table for the evening meal. I had been informed that he was a well-known athlete, and I expected that he would be taking every chance to talk about his sporting pursuits. However, despite it being such a major part of his life, I quickly found out that he rarely talked about such matters. Instead, the conversations Mark started were about the lack of evidence for what we were doing in hospital medicine. Some of the other doctors at the table were clearly getting agitated, at which point Mark put forward his challenge. If you are claiming to adhere to evidence-based medicine, where is the evidence that this hospital provides net benefits to the health of this city? In order to find out, would we not have to split the city into two, with half of the population coming into the hospital as they currently do, and the other half avoiding the hospital, as well as its funding burden? Then over several years we could collect health outcome data and make a comparison. One of the other doctors was outraged and said that it would be completely unethical, as clearly the hospital saved lives. Mark replied that may be the case, but what if it was harming more people than it was helping? That would also be unethical. Or what if the cost to buy a patient an extra year of life was $1 million? Would it be ethical to take resources from thousands of people to fund such a measure? One of the trainee surgeons who had been sitting contemplatively through the conversation then said, "Perhaps Bailey has a point. We don't have the evidence. Maybe this hospital's biggest role is that it provides the public with a sense of security, a belief that we can help if anything goes wrong. Perhaps they would be worse off if they knew the reality of how little we can do for their overall health." By 2016, Mark had become completely dissatisfied by the medical system. He attended his last clinic and then exited it permanently. For myself, the final straw was the onset of the COVID era. I could not be part of a system that had been weaponized against entire populations, a system that had nothing to do with health. I did not apply for a medical license after 2020, the year the quote authorities started gag order and prosecution attempts against me. You can watch my recent video exposing the plan to extort Dr. Sam, where I provide an update concerning how they are still coming after me in 2025. In retrospect, however, COVID-19 had a silver lining in that it fully woke up those of us who were already skeptical of pharmaceuticals and many allopathic practices. We embarked on a deep investigation into the alleged pandemic and the topical scientific claims being made. Additionally, there was a discovery of the pioneers who had already questioned and refuted various aspects of claimed pandemics. The most influential for me personally was the book Virus Mania, and in 2020 I was asked to join the original authors, Torsten Engelbrecht and Dr. Klaus Kernlein, as a co-author for the new edition. That introduced me to the historical work of the Perth group, Dr. Stefan Lanker, Jim West, and David Crow. From here, the research exposing pandemic and germ theory fraud expanded into many other aspects of allopathic medicine. Unsurprisingly, when it comes to counter-narrative evidence, most of the historical publications are from independent investigators and dissident doctors. However, sometimes it is found in mainstream or even establishment sources. One such example was Dr. Milton Rosenau's human transmission attempts with the Spanish flu from 1918 to 1919. You can watch many of my presentations, which cover this complete failure to demonstrate that influenza can be transmitted between human subjects. The point here is that the Rosenau experiments were funded by government agencies and published in mainstream journals. Another example is the article, "Is US Health Really the Best in the World?", published by Dr. Barbara Starfield in the Journal of the American Medical Association in 2000. This was first introduced to me by investigative journalist John Rappaport, and as I wrote in my foreword to Terrain Therapy. When Dr. Barbara Starfield revealed in 2000 that around 225,000 patients were dying annually in US hospitals due to medical errors, it should have been one of the scandals of the century, keeping in mind that this does not include the iatrogenic deaths and injuries happening outside the hospitals. It is clear that the medico-pharmaceutical industry has blood all over its hands. But the focus of this video is a lesser-known paper that was published in 1977 titled "The Questionable Contribution of Medical Measures to the Decline of Mortality in the United States in the 20th Century." It was written by John and Sonia McKinlay, both of whom were originally from my home country of New Zealand. John was a medical sociologist and epidemiologist, while Sonia was a mathematical statistician. Their 1977 paper opens with the quote, "By the time laboratory medicine came effectively into the picture, the job had been carried far toward completion by the humanitarians and social reformers of the 19th century. Their doctrine that nature is holy and healthy was scientifically naive, but proved highly effective in dealing with the most important health problems of their age. When the tide is receding from the beach, it is easy to have the illusion that one can empty the ocean by removing water with a pail." This was written by the French microbiologist René Dubos, and some of you may recall that we mentioned his work in Virus Mania. I also referred to Dubos in my 2021 video, Germ Theory versus Terrain Theory, pointing out that while he was not fully in the terrain camp, he used the term opportunistic in a 1955 paper, Second Thoughts on the Germ Theory, coming very close to the terrain position on the true role of microbes. In any case, the article itself states the following in its introduction. "The modern quote heresy that medical care, as it is traditionally conceived, is generally unrelated to improvements in the health of populations, as distinct from individuals, is still dismissed as unthinkable, in much the same way as the so-called heresies of former times. We also know that vast institutional resources have often been deployed to neutralize challenges to the assumptions upon which everyday organizational activities were founded and legitimated. And since it is usually difficult for organizations themselves to directly combat threatening, quote, heresies, we often find otherwise credible practitioners perhaps unwittingly serving the interests or organisations in this capacity. This theme was certainly evident during the COVID-19 event, with most doctors going along with the preposterous narrative, trying to talk with them about dubious virological claims, PCR diagnostics, or the harmful population-wide controls being enforced usually went nowhere. The possibility that the medical establishment was propagating one of the biggest frauds of all time was not going to be even slightly investigated by the majority of doctors. Back to the 1977 paper and to the McKinley's note that little data related to the effect of medical interventions had been published for the United States at that point in time. However, they quote a 1975 paper by Thomas McEwen et al. That stated of the decline of mortality in England and Wales during the 19th century. Examination of the diseases which contributed to the decline suggested that the main influences were A. Rising standards of living, of which the most significant feature was a better diet, B. Improvements in hygiene, and C. A favourable trend in the relationship between some microorganisms and the human host. Therapy made no contribution, and the effect of immunisation was restricted to smallpox, which accounted for only about 1/20th of the reduction of the death rate. And with regard to the period from 1901 to 1971, the main influences on the decline in mortality were improved nutrition on airborne infections, reduced exposure from better hygiene on water and foodborne diseases, and less certainly immunisation and therapy on the large number of conditions included in the miscellaneous group. So their analysis presented an underwhelming picture for the contributions of medical measures. The authors were still attempting to fit germ theory into the analysis by suggesting that the diseases were infectious, but that did not change the fact that the improvements were evidently not coming from the medical system. They tenuously suggest that vaccinations may have had some minor effect in reducing mortality, but this cannot possibly be the case, as we shall see. The McKinley's first chart maps the overall mortality rates per 1,000 people in the United States, and it shows a dramatic and essentially continuous decrease from 1900 to 1973. Over this period, the rate comes down to almost a quarter of what it was for females and a third of what it was for males. The second chart maps the decline in the overall age and sex-adjusted rate from 1900 to 1973. We can see that overall mortality dropped by about 70% over this period. The broken line is described as an absurdity by the McKinleys because it plots the astronomical rise in medical spending as a proportion of gross national product. They write that it is evident that the beginning of the precipitate and still unrestrained rise in medical care expenditures began when nearly all 92% of the modern decline in mortality this century had already occurred. Finally, the third chart maps how the proportion of deaths contributed by, quote, infectious and chronic conditions has changed in the United States since the beginning of the 20th century. It shows that in 1900, 40% of all deaths were accounted for by 11 major, quote, infectious diseases and 16% by 3 chronic conditions, heart disease, cancer and strokes. By 1973, only 6% of all deaths were due to these infectious diseases, with the chronic diseases increasing to 58% of all deaths. Based on the findings from charts 2 and 3, the McKinleys concluded that most of the observable decline in mortality was due to the rapid disappearance of some of the major infectious diseases. As there are purportedly specific medical measures for these conditions, they then focused their analysis on assessing the effect of these interventions. They noted that no analogous interventions exist for the major chronic diseases, such as heart disease, cancer, and stroke. Any attributed benefits from medical measures for the infectious diseases were found to be small, down to non-existent. Furthermore, when the introduction of the intervention was shown on charts with year on the x-axis, any purported benefit became even more dubious. For example, the mortality rate for measles were almost at zero when the vaccine was introduced in the early 1960s. and the introduction of various antibiotics, such as penicillin and isoniazid, in the 1940s did not impact on the already massively retreating mortality rates for scarlet fever, tuberculosis, and typhoid. Similarly, mortality rates for pneumonia were already well down with the introduction of the antibiotic sulfonamide in the 1930s. The introduction of influenza and whooping cough vaccines did not impact on the declining trend lines, and the McKinley state, it is only for poliomyelitis that the medical measure appears to have produced any noticeable change in the trends. Here we need to take a segue to explain why they made such a claim about the polio vaccine, for it is apparent that the McKinleys were using unreliable data. We will set aside the fact that a poliovirus has never been shown to exist, and the so-called transmissibility evidence was based on uncontrolled experiments involving the injection of diseased material directly into the brains of living monkeys. Instead, we can look at the research of Jim West, who not only charted the US polio mortality, but the incidence figures which clearly showed that the epidemic was already sharply declining before the introduction of the vaccine in 1955. West also noted on this chart that the incidence had an incredibly strong correlation with the amount of DDT being produced in the United States. Similarly, we can look at the polio experience in a comparable country to the United States. Vaccine researcher Greg Beatty obtained the official mortality figures in Australia and produced this chart. We have added an approximate trend line in red, and clearly it would be absurd to claim that the introduction of the vaccine could be given credit for any significant reduction in mortality. So although it has been claimed that the vaccines did make some beneficial impact in the 1950s, some of this was due to various forms of data manipulation. As we wrote in our book, The Final Pandemic, the incidence of polio was also influenced by the way it was classified, particularly after the introduction of the vaccines. In this instance, cases that would have previously been called polio were reclassified to other neurological conditions, such as multiple sclerosis, cerebral palsy, and Guillain-Barré syndrome. Such deception made it appear as though the vaccines had helped eradicate polio. For more details on the polio scandal, you can watch my presentation of William Engdahl's Toxicology versus Virology, Rockefeller Institute, and the Criminal Polio Fraud. Back to the McKinley's 1977 paper, and they conclude that, with reference to those 5 conditions, influenza, pneumonia, diphtheria, whooping cough, and poliomyelitis, for which the decline in mortality appears substantial after the point of intervention, and on the unlikely assumption that all of this decline is attributable to the intervention, it is estimated that, at most, 3.5% of the total decline in mortality since 1900 could be ascribed to medical measures. However, as they point out, this 3.5% would be an upper limit claim, requiring an unrealistic assumption. Furthermore, with the now known misleading polio data taken into account, the figure would move closer to 0. In fact, allowing for margins of error, it would need to be considered whether the overall effect of medical measures last century was in the negative. That is, more people have been killed than saved. In December 2020, Professor David Kindick penned a commentary in the Millbank Quarterly titled "The Still Limited Contribution of Medical Measures to Declines in Mortality." He praised the McKinley's important paper, but went on to say that it should be noted that some anti-vaccine advocates have used the McKinley's paper as scientific support for their views. To this, the McKinleys reply that we consider this an egregious misinterpretation of our research. Effective vaccines clearly have an important role in the ongoing containment of a disease after its prevalence has been reduced. Measles provides an excellent current example of the resurgence of a previously contained infectious disease following reduction in measles vaccination interventions. It is hard to imagine why they would act as vaccine apologists after publishing such data and employ medico-pharmaceutical propaganda to prop up another false narrative. On this matter, I always recommend Jordan Henderson's comprehensive series, Vaccine Evangelists, Apostates and Apologists, which outlines the confused and/or contradictory claims made by vaccine proponents. An example of contradictory claims being, because of vaccines, we live 30 years longer than we did 100 years ago. And then, no one ever said that vaccination did account for the impressive declines in mortality seen in the first half of the 20th century. You can also watch my video, The Measles Myth, where I outline why there is no evidence for a measles virus, and thus no need for an alleged measles vaccine. For those of us who have investigated virology and the wider concept of germ theory, it is clear why medical interventions such as antibiotics and vaccines have failed to save lives when these population-wide figures are examined. The foundational mistake is calling some diseases infectious or contagious when the scientific evidence for such claims is lacking. You may recall that Thomas McEwen and co. suggested that the dramatic declines in mortality rates last century could be explained by, quote, a favourable trend in the relationship between some microorganisms and the human host. If only such researchers would take the next step and examine the evidence that microbes possess any pathogenic abilities. Another paradox on the establishment's own terms is that while acknowledging that so-called infectious diseases fell largely into insignificance last century, in the present era we are expected to believe that dangerous pandemics can break out at any moment. At least we can take strength in the fact that more people are awake to the fraudulent pandemic industry than they were in 2020. The COVID deception has also led many people to being sceptical of the wider medical industry. As the present video has highlighted, several of the most famous claims from the medical establishment simply do not stack up. In the middle of last century, former allopathic physician and surgeon Dr. Ulrich Williams stated that the modern medical system, to the extent of perhaps 80%, is nothing but a gigantic, cruel, ludicrous, lucrative, transparent fraud. It is now no better, except that it is even more lucrative for the beneficiaries. Recall that in 1977, the McKinleys described the amount being consumed on medical care as an absurdity. Look what has happened since then with US spending on, quote, health as a percent of GDP being far greater now than it was in the 1970s. Furthermore, the Statista website is forecasting a rise to around 1/5 of GDP by 2031. For those protesting that the medical spending may not be improving mortality rates, but may be improving other health metrics, we suggest you take a look around. Think about the unprecedented rates of obesity, childhood inflammatory conditions, chronic disease, increased cancer rates, including in younger age groups, not to mention the absurdly high prevalence of mental illness. The medical system cannot cure these problems in the 21st century, just as its ineffectiveness in the 20th century was clear to see.
What is healthcare? The definition of healthcare is maintaining or restoring health. That's the definition of healthcare. So now let's look at our healthcare system. Does it maintain health? No. Everybody's sick, and we wait for you to get sick. We don't keep you well. We wait for you to get sick, and you do. Then once you are sick, we don't restore your health. We merely manage your symptoms. So we can manage your high blood pressure, we can manage your cholesterol, we can manage your pain, your arthritis pain, we can manage your diabetes. We don't cure you. So we are not maintaining or restoring health. So the current healthcare system is a hoax. It is not a healthcare system, it is a disease management system. And this disease management system is running up the bills because everybody's sick and the costs are going through the roof. And at this point in time, those costs are threatening the viability of our country.
So, what can you do? Do not outsource your health to an entity that has failed to deliver and is focused on its own ends. Take control of your life and seek answers from the practitioners and researchers who have moved away from this broken system. We also have plenty of free resources at drsambailey.com. So much of this information has benefited my family, and I'm sure it will benefit yours too. If you enjoyed this video, please visit supportdrsam.com.